Yes, welcome back from that lovely break. This is Smart Means Business, and my name is Falde Chirabo. Now, we were continuing with conversations around the second inauguration of His Excellency Donald Trump, the President of the United States of America. Now, when it comes to this gentleman, a number of people actually celebrated him when he got his seat, and it comes off like he is actually the president of the whole world. Well, that is simply because every decision that is made in the United States of America is bound to affect the whole world at large. And that is simply starting off with the new Trump administration, which halted HIV drug distribution in poor countries. Now, this distribution has been made by a number of non-governmental organizations that are funded by the United States of America as well. Now, when we look at the foreign policy of spending, foreign expenditure by the United States of America, it equates to over 40 billion US dollars annually. Now, with the new Trump administration, they want to revise that and be able to save something for the states themselves. So when it comes to the Ugandan or the poor countries that are involved in this foreign spending, Uganda is one of them, and that is when we look at the organization, the non-government organizations that are being funded by the United States. We look at the presidential emergency plan for AIDS relief, which is also directed towards HIV treatment and HIV, fighting against the spread of HIV within the poor countries. However, we also have one that is commonly known or largely known globally, that is known as USAID, also known as the United States Agency for International Development. Now, this organization has been operating in over 100 countries, providing humanitarian support, aid, as well as helping refugees, and also taking part in healthcare as well as education, to mention but a few. Now, when we talk about halting foreign aid, that means that these organizations are going to be paused operation, or the funding by the US government is going to stop towards them for the next 3 months or 90 days. Now, when we look at this, of course, it is one that is going to impact a lot of countries that were previously enjoying these benefits, or at least getting something from these benefits. However, in Uganda's space, you also know another initiative that is still funded by the US government, known as the Presidential Initiative on AIDS Strategy for Communication to the Youth, known as PIASI. Now, over time, these organizations have been able to help Ugandans in a very, very big manner, and that is through HIV, stroke, AIDS treatment and prevention. They've also been able to fight other communicable diseases such as malaria, tuberculosis, to mention but a few. Now, they've also improved maternal and child care as well, or child health, given that previously HIV could commonly spread through mother to child birth. Due to that process, it was unsafe, but they've been able to help us get over it by the technological advancements, the healthcare facilities that they've put into place. However, like I said earlier, Trump's administration has put that on a hold so that they can be able to revise the foreign policy, remembering that at least they spend $40 billion annually, and at least they've also this Trump administration has also seen that the United States is withdrawing from the WHO, or the World Health Organization, where it has been contributing at least 15% of the donations that have been helping to feed people, as well as carry on the activities of the World Health Organization. Now, when it comes to HIV and the talk and how this is going to affect the Ugandan space, of course, we cannot fail to look at the statistics of the HIV rate, or the HIV infected people in Uganda's economy. Now, starting off, at least 3.4 million Ugandans are living with HIV today, and that being 15 to 49 aged people, or the adults and the youth are about 15% of that population. And the new HIV infection rates are moving at 52,000 per year. That means that every week at least 1,000 people are diagnosed with HIV/AIDS. Now, when it comes to HIV-related deaths per year in Uganda, it is attributed to about 18,000 cases per year. Now, when we look at these statistics alone, that it means that there is a number of people who are losing their lives every other day because of HIV. However, the numbers have been gradually reducing over time because of the help that we have been able to attain from the United States of America. And we've seen that the achievements that they have put into place have also attributed to the reduction of HIV/AIDS on the scope of Uganda. However, with this withdrawal, of course, it's going to be able to lead to a number of negative side effects, I must say. And that is, of course, leading to increased HIV cases and treatment interruptions. Now, we all know that when someone is diagnosed with HIV/AIDS, they are put onto a medication that is going to last for their lifetime, so that it can be able to help the antibodies in the body, be able to help them still fight or boost their immunity. And that is known as the ARVs. But the fact that the drugs have been halted, that means that there is going to be a lot of disruptions or interruptions when it comes to the treatment. Different people require different levels of the ARVs, and now that they won't be supplied, of course, it leaves a question of how are we going to be able to live and help the people suffering from HIV/AIDS. And of course, let's not forget to talk about the increased cases. Now, when we look at Uganda's scope alone, it is actually quite interesting because it is not just HIV/AIDS that is being transmitted sexually, but we are also having an increase in monkeypox that is also a sex-related disease that has been on a rampant, or the spread has been on a rampant because of the increased sex trade activities of Ugandans. Now, I don't know if it is a problem that has to do with the spread of the disease or the fact that we Ugandans are slow to tame our habits or to improve our lifestyles when it comes to certain things. But there is a guarantee that there will be increased spread of HIV given that this help has been withdrawn away from our economy. Moving forward again, there is going to be a strain on healthcare services. NGOs have been taking up a very big part in helping us with healthcare facilities, as well as machinery and technology that has helped us transition over time and helped us suppress the spread of HIV. But with the withdrawal of support from the United States of America, that means that a lot is going to change in that space. And there is going to be a strain on healthcare services. Take a look at USAID, for example. Lately, when you are watching the television, when you are seeing banners, most of the healthcare related situations are always funded by the USAID. But given that it has been put on a halt as well, that means that there is going to be a lot of strain on healthcare services, as well as the government of Uganda to start with. Moving forward again, we see that the fact that they've withdrawn support, foreign support to other countries, or just poor countries, the funding gaps for NGOs are going to be widened because they will have limited funding to receive so that they can be able to help the masses out there. And I already gave an example of the World Health Organization, which was receiving at least 15% of its donations from the United States of America. That not only is not going to be the only challenge by this action taken by the Trump administration, but there is going to be an increased level of unemployment in Uganda's space, given that most people were actually employed by these non-governmental organizations that were funded by the United States of America. So there is going to be a likelihood of potential layoffs as we move on or as we move forward with this transition. And let's be reminded that this is going to go on for the next 90 days or equivalent to 3 months. So the question will be about how we are going to be able to survive regardless of the reduced support from the United States of America. Earlier, like I earlier said, there will be loss of employment, and that is something that is bound to happen given that there is no more support, or there is reduced support. There is going to be increased layoff of workers. And as we saw in today's article of the Daily Monitor, the front page specifically, USAID alone is going to be laying off 2,000 workers or employees. And of course, that is such a devastation, I must say. Moving forward, of course, there's going to be increased mortality rates. The US is, should I say, modernized when it comes to healthcare and other things specifically. So the fact that they've withdrawn their support to us means that there is going to be the question of life and death within the patients who were previously being supported by the United States funds. And that, ladies and gentlemen, gives us a lot of questions to ask ourselves. How are we going to be able to pick up ourselves and continue regardless of whether the situation or whether the funds are coming in or not? However, I do believe that there is something that is going to be done about that. And let's talk about the fact that we weren't given an ultimatum when this happened. It is not like we were told weeks or months back that this would be happening. However, we were told at the same time that everyone else got to know. So that means that we actually have to come up with a very quick backup plan to still secure the livelihoods of our citizens, of Uganda's economy. And lastly, there is going to be rising dependence. The US has withdrawn its foreign support due to reasons best known to its president as well as the new administration. So it leaves the question of who are we going to rely on to receive the aid that we're previously receiving from the United States of America. Ladies and gentlemen, I would love to sit here and tell you that we should be able to point fingers and continue pointing fingers to the bodies that have withdrawn. But the question comes back down to us. HIV or HIV/AIDS is not a disease that is airborne. Rather, it is a disease that is sexually transmitted. So that leaves the question of how are you living your life today? How are you caring about your lifestyle? Because everything you do is bound to affect you. And I would love to sit here and tell you that I would have a solution for you if you contracted the HIV virus. But I would say that I don't, because at the end of the day, it is your life, and before it is someone else's responsibility, before it is the responsibility of the government or the United States of America, please be reminded that your health is your wealth. And that is just something that comes down to you as a person. So before you engage in anything that can be able to put you at risk, put you in a situation where you may need to attain a lot of support, please think twice. Yes, and when I look at this whole situation, it just reminds me to always have a backup plan for anything that you do. That is why we sit here and preach to you to actually take part in insurance policies, because you do not know what tomorrow holds. Yesterday, we had the support of the United States of America, and today we do not. So that leaves the question of how are we going to be able to navigate through this ordeal and come out as winners at the end of the day. So ladies and gentlemen, that and more is some of the conversations around the previous installation of the President of the United States of America. And I believe that it is just beginning, because it's not even a month since he has sworn in to be the next president. It has just been a few weeks, I must say. So I remind you to take care of yourself, and of course to stay tuned in to Smart Means Business, because we are dedicated to bringing to you the best business news to help you make the best business decisions. Stay tuned as we go for a break. See you then.